Action.
Good afternoon. Today we are going to be speaking about the hepatitis B infection, the causes and the spread of the virus and the prevention. But more specifically, we're going to be talking about the hepatitis B vaccine and the importance of the vaccine. It's important to know the facts about the virus and consider getting the vaccine to prevent this serious illness. Hepatitis means inflammation of the liver. When the liver is inflamed or damaged, the function is altered, and this can cause very serious illness. The World Health Organization defines hepatitis as a viral infection that attacks the liver and causes both acute, which is short-term infection, and chronic, which is long-term infection. According to the Center for Disease Control, hepatitis B is spread when blood and body fluids of someone who is infected enter the body of someone who is not infected and not vaccinated. Risk factors for spreading the virus include mother to baby during birth, through sexual contact, sharing of needles or medical equipment, or occupational exposure. As healthcare workers, we are all exposed to the virus and should consider being vaccinated for the hepatitis B. The World Health Organization estimates that 296 million people worldwide were living with chronic illness from hepatitis B in 2019, with 1.5 million new infections every year. This is a staggering number of people suffering from an infection that is preventable. The World Health Organization states that a safe and effective vaccine that offers 98 to 100% protection against the hepatitis B is available, yet many Americans die every year from this disease or the side effects and the other chronic illnesses that it will cause. The Association for Professionals in Infection Control and Epidemiology states that vaccines are very effective in preventing the suffering and the cost associated with care once people are infected. Viruses and bacteria that cause illness and death still exist and can be passed on to people who are not vaccinated. The hepatitis vaccine can prevent the virus and the serious health consequences of the infection, including liver cancer and cirrhosis, and that is right now we're talking about the hepatitis B virus vaccine. All unvaccinated adults at risk of the hepatitis B virus should be vaccinated, and we encourage everyone to do so. The hepatitis vaccine is very safe. Most people don't have any problems with it. Anyone allergic to baker's yeast or any other component of the vaccine should inform their healthcare provider before they get the vaccine and let them know, and they maybe should not take the vaccine. The hepatitis vaccine is made from part of the hepatitis B virus, but it cannot cause the virus. So many people worry that they will get the virus or get the flu from the flu vaccine. Well, with the hepatitis B vaccine, you cannot get the virus from the vaccine. It's usually given in a series of 3 injections in about a 6-month period of time to become fully vaccinated. The side effects are mild, low-grade fever, and soreness at the injection site are the most common. Severe side effects are rare, and the chances of serious harm or death is extremely rare and small with the vaccine. Routine hepatitis vaccination of children in the United States began in 1992, and according to the CDC, the reported incidence of acute hepatitis B in children has dropped by more than 95% and by 75% for the whole population. The American Academy of Pediatrics recommends that infants receive the first hepatitis B vaccine within 24 hours of birth before leaving the hospital to improve their protection against a potentially fatal disease. This timing maximizes the effectiveness of preventing the infection and illness. Dr. Flora Munoz, a member of the American Academy of Pediatrics Committee on Infectious Disease, states, "It is important that no child, no infant leaves the hospital without being vaccinated." The adult vaccine is also non-infectious and very effective in preventing the disease. As people travel around the world and engage in high-risk behavior, it is important that adults get the vaccine. There is no risk of developing hepatitis, and it is also a series of 3 shots administered in a 6-month period of time. Children and adolescents who do not get the vaccine when they were infants should also be vaccinated. The Occupational Safety and Health Administration, as we know as OSHA, states any workers who have reasonably anticipated contact with blood during the performance of their jobs are considered to have occupational exposure and to be at risk of being infected. Employers must develop an exposure control plan and implement policies to protect workers who are at risk of exposure. The employers must also make it free of cost to the employees. The OSHA standards require employees to offer the vaccine series to all occupationally exposed employees. According to the World Health Organization, mostly newly infected people have no symptoms. Therefore, that is a time when the disease is spread more rapidly to family members, friends, the community, and co-workers. So much information is available on the benefits of receiving the hepatitis vaccine. The Centers for Disease Control, World Health Organization, Occupational Health and Safety Health Administration, and the American Academy of Pediatrics all recommend vaccination. As healthcare workers, let's set an example and trust the science concerning the disease. Infants, children, adolescents, and adults can all be safely vaccinated. We can inform, educate, and encourage our coworkers, family members, and friends on the success and safety of the vaccine. The facts are clear. The vaccine is 98 to 100% effective. Please be proactive. Protect yourself, your family. Why suffer the chronic effects of a preventable disease?